celebration this afternoon as we announce yet another cardiovascular first for Mercy Springfield. There's a heart condition called severe aortic stenosis, a disease of the aortic heart valve that afflicts many people in our local and regional communities that we serve, especially our senior population. The traditional approach that's required is open heart surgery to replace or repair the heart valve, but many of our patients can't tolerate this type of invasive procedure and are left in a debilitated condition with substantially reduced quality of life. Enter the concept of transcatheter aortic valve replacement, abbreviated TAVR or TAVR, a new technology that allows a team of physicians to replace the aortic valve of the heart in a semi-invasive manner, percutaneously through the femoral artery in a patient's leg. Almost 2 years ago, while this technology was still in FDA trials, the Mercy Clinic cardiologists and cardiovascular surgeons identified a community need for this less invasive treatment for severe aortic stenosis and approached me to create and execute a project plan that would allow us to implement a transcatheter aortic valve replacement program right here at Mercy Springfield. Collectively, we approached the Edwards Life Sciences Company in Irvine, California, the manufacturer of the Sapien transcatheter valve product and its delivery system. And after a substantially long time of hard work and preparation, we successfully partnered with Edwards to bring this new life-changing technology to the people of Southwest Missouri and Northwest Arkansas. I am pleased to announce that my colleagues, which include a team of highly skilled Mercy Clinic cardiologists and cardiovascular surgeons, and a new multidisciplinary group of other talented professionals, many of which are here, flawlessly performed the first 2 transcatheter aortic valve replacement procedures ever done in Southwest Missouri, right here at Mercy Springfield. And it was done on March 7th, 2012. Since this early March date, I am very proud to say that our dedicated team of doctors have completed 6 more transcatheter valve procedures with wonderful patient results. I am very proud that this incredible technology has dramatically enhanced the quality of life for the individuals that it has touched, establishing us as one of the premier valve centers in the Midwest. To speak about the clinical results and details associated with this breakthrough technology, it is my honor and privilege to introduce the collaborative team of Mercy Clinic physicians that are responsible for the development and deployment of the transcatheter aortic valve replacement program here at Mercy Springfield. First, Dr. David Cochran, interventional cardiologist, chief of cardiology, and medical director of cardiovascular services. Second, Dr. Suresh Parvathanini, cardiovascular surgeon and chief of cardiovascular surgery. Third, Dr. Robert Merritt, interventional cardiologist and medical director of the Vascular Center. Fourth, Dr. Fawn Wong, cardiovascular surgeon and director of minimally invasive valves. And Dr. Sharad Bansal, a non-invasive cardiologist and medical director of echocardiography services. Gentlemen, thank you for your fine work. Dr. Merritt, if you would please.
Thank you, Andy. And first I want to say I appreciate all the effort that's been put into this project over the last 2.5 years. We've traveled many miles and gone to many centers, including New York, and had several proctors from Europe and the United States to help us institute this valve therapy at Mercy Clinic. And I'd really like to recognize and appreciate our surgical colleagues, and I'd like to ask Dr. Parvathanini to come up here as well, and we'll kind of explain the process of the transcatheter valve. It's a collaborative approach to a less invasive surgery and combination percutaneous approach that allows inoperable patients that would more than likely die from a surgical procedure to now undergo a less invasive procedure that gets them out of the hospital quickly and helps them recover. And we have a couple of patients here that we'll introduce in a few minutes, but Dr. Parvathanini, would you like to come up and say a few words, and then we'll explain how the procedure is performed.
Hi, just wanted to say that we're really happy that you guys could be here today and take some time out of your busy schedules to see what we've done here at Mercy. Kind of since the first valve was implanted by Alain Quivrier in France, this technology has actually expanded to the point where we can actually use it here in U.S. centers. We did our first 8-valve percutaneous valves, and they were all doing very well. But these are patients that really we had no operative therapy for them, and actually their long-term survival was basically very dismal. This has really opened the door for them to really enjoy their lives, especially during the golden years, and it's given us something that we can get back to them. Usually these were the patients we kind of right off the road, but now I think with this new technology and where we're going, you know, the future is the sky, is the limit basically. I think cardiology and cardiac surgery are kind of going to meld together, where we're going to be doing both of the same things. Pretty soon you won't hear that phrase cardiac surgery or cardiology. You'll see structural heart centers, where we have a group of guys who are specialized, such as Dr. Merritt Cochran and Dr. Fong Wong, in doing these procedures. And I think, you know, we were obviously very appreciative of Mercy for allowing us to bring this technology here, and actually all the physicians and everybody involved in this, Carol Miller and all our staff, you know, we want to really thank them, as well as Jane, who schedules them. We want to leave them out, as well as the Room 10 girls, where we do these valves, and they've done an excellent job and allowed us to do what we need to do to become more technologically savvy. Right now, I'll turn it over to Dr. Merritt, and he'll give you a little brief presentation how the valve goes.
Great. Thanks, Dr. Parvathanini. We can go ahead and start the film up over here on the wall here, and I'll just kind of narrate it as it goes along, and if you can follow it closely, it's pretty self-explanatory. This is applied from the Edwards Life Science Company as a kind of educational tutorial about heart valves 101. So this is the heart valve that's pumping, and it's severely sclerotic. The valve opens and closes. We enter the leg through an incision at this point, and then we advance a wire all the way up the aorta, past the kidneys, over the aortic arch, and through the heart valve. Once we're through the heart valve and we have a secure position, we pass a catheter with a balloon. And the balloon initially dilates the valve open, and you'll see that at this point. Balloon inflation is performed while the heart is beating rapidly because of a pacemaker. That stills the heart so we can allow placement of the valve correctly. Once again, we pass now a larger catheter that has the stent on top of a balloon catheter, and the valve is sewn into the stent. So basically, we're going to embed a new stented heart valve into the previous valve. We cross the valve, we position it, we still the heart with a pacing mechanism. Right there, balloon the valve is left in place with the new stent valve and the new valve working easily. The procedure realistically takes about an hour to do. And the patient is anesthetized at this point, and we do have surgical access to the right femoral artery. In the future, as the future with many things, they'll be miniaturized, just like the iPhone. It's going to be small, it's going to be quick, it's going to be very useful. So now I'd just like to turn it over to our other colleagues to introduce some patients and tell you how they're doing. Thank you very much.
I'm Dr. David Cochran, and we have some patients here with us who are our first patients who underwent this successful procedure. As Dr. Parvathanini said, we've done 8 successful cases now. The problem with aortic stenosis is that it's the valve is no longer opening fully, and as you can tell from the presentation behind us, that the valve becomes calcified, it becomes thickened, and it doesn't open, and the heart has to work much harder, and the patients who have aortic stenosis are left with a lower cardiac output. And the problem with that is it leads to symptoms of angina, shortness of breath, and congestive heart failure, and it can also be a cause of sudden death. For patients who are not strong enough or healthy enough to undergo conventional open heart surgery, this now gives our patients a third option, which is much better than the only option of just medication. So this now gives these patients an option to have a new valve placed, but much less invasively. And the patients who are with us, Mr. Harold Block and Mr. Anthony Agostini, both were quite ill with their aortic stenosis, which is very common with this disease. Mr. Block could hardly do anything outdoors that he had been doing the year or two prior, very limited, extremely short of breath, and basically becoming confined to a chair. Mr. Agostini was actually hospitalized 2 or 3 times with just overt congestive heart failure, needing intravenous medications to keep the fluid from building up. And by going in and us being able to offer this new procedure for them, we can relieve that obstruction to the heart. Fixing that valve relieves the pressure overload and basically gets them back to the state where they should be to enjoy a much more comfortable life. Their quality of life is going to be a lot better, and their symptoms are going to be a lot less, and the number of years that they have left will be much better with this new procedure. So I think they've had a good outcome, and it's been very exciting for us to offer this to them, whereas in the past, we really couldn't offer an operation or a procedure. It would just be medications, and the quality of life with that is just not very good. So they're here with us today, and as you can tell, they've not had to be rehospitalized since then and doing much better. We're very pleased with that, and I think they are too.
Thank you, Dr. Cochran. At this time, I'd just like to thank, on behalf of Mercy Springfield, I'd like to thank all of you for attending today, and I thank all of you for actually celebrating this achievement with us. At this time, I'd like to invite the media to ask questions, and we'll proceed from there. Thank you very much.